Hey guys, Dr. Michael Derry here today. So I want to talk about lower back pain after walking. And walking is such an interesting thing in that we're built to do it, but sometimes our back can be really uncomfortable, whether it's achy or stiff after walking. And I want to talk about two things that I always work with clients when we're kind of deciphering, like, what's causing your back pain while you're walking? Is it from your disc? Is it from arthritis? Is it because of your muscles? And we're going to review some of those things today. And I want you to have two great takeaways and things you could be doing to help improve your lower back tolerance while walking, whether that be longer distance or less discomfort, or maybe a bit of both. But walking is something that we should be able to do. Let's get to that without as much lower back discomfort. So there's two things I want to consider when I'm treating people with lower back pain and walking. So typically, that lower back pain kind of sits in this region here, maybe radiating off into the glutes a little bit, but kind of sits in the lower back. And 9 times out of 10, I'm treating clients that are telling me, man, it just feels stiff. I have a hard time standing up against gravity, or the pressure builds in their back and they have a hard time staying upright. Now, the two things that I want you to consider are anatomy and physiology and biomechanics. So let's go over both of those things. So anatomy and physiology is the way that you're built. And so most of my clients are in the 4th, 5th, 6th decade of life, and that they have a little bit of changes going on in the lower back. And those changes often are arthritis or degenerative in nature, and it could be degenerative disc disease or stenosis or just plain old facet arthropathies or arthritis or disc bulges and those types of things that are within the realm of normal when you get in those decades of life that can cause exactly what I was just telling you about, like that pressure, that building up, that stiffness, that uncomfortableness in your lower back. And a lot of those things are very normal to feel in this region and can absolutely inhibit our walking ability unless we start working on it. So that's kind of how you're built. And those are the most often changes that I see in someone's lower back that's having problems with walking. Now, you can also have something that's called lumbar spinal stenosis. And that is due to the changes here in the actual intervertebral space where that nerve root comes out of. And you start to lose some space around the nerve. And I have other videos that are related to spinal stenosis that you should check out, because that's more of a specific condition related to walking. And majority of those clients have symptoms that go way down into their leg. What I'm referencing here are symptoms that are kind of just sitting in your lower back, kind of pressure building, stiffness, achiness, that can inhibit our ability to walk and definitely feel super stiff while we're doing it. And I want to talk about ways that we can improve that. But when we think about why is that happening, one of the things that we think about is anatomy and physiology, like how you're built and the changes that are going on in your back. Because we can't necessarily make a difference on those changes, but what we can do is help improve your body in specific patterns that have been proven to improve your ability to walk, even if you have that stuff going on. And I'll go over those things later on in the video, the things that I've found to be really beneficial for those clients. The other thing we need to think about on lower back is, well, it could be the way that you're built, but what about your muscles? And so a lot of times the lower back muscles, the ones that sit in this space here, that is in between the spinous process and the transverse process, that space, I don't know if you can see it a little bit better here, it's a little bit of a canal right there. And that canal houses a bunch of muscle that can feel really tired, aching, fatigued as we walk. And so one of the biggest differences that I see, if you're older or tend to have some of those changes in your spine, whether from an X-ray or an MRI, we know that those changes can cause that stiffness and achiness. If it's more muscular related, is that we tend to lose that fight against gravity, and that as we walk, we tend to make our way down here because, man, those areas are just becoming really tired and fatigued. But when you sit down, it feels better. In both of those scenarios, they're kind of treated similarly, but the outcomes can be a little different, where if it's more muscular focused and based, and you're just having a hard time walking, or your muscles are really tired, it's either due to endurance deficits, or it's due to maybe you have a little bit too much weight forward, and that weight is pulling on your lower back and just making your muscles really, really tired. And tired muscles respond well to rest and strengthening. And so we'll go over, there's some strengthening exercises that you can do. But for those that have the age-related changes here, or those changes that we found in X-rays and MRIs, more joint-related, we can definitely improve walking ability and tolerance. But when we look at how you're built, the physiology, we really need to lean more towards the biomechanics on like, what can we be doing to your body to help make it feel better. I hope that makes sense. So it could be two separate things, right? It could be how you're built or how you're doing it, right? The biomechanics. And so we take both of those things into consideration when we're working with people that want to improve their walking ability and tolerance to walking. But the way that we do that could be a little bit different. So I want to go over two great mobility stretches and work that I do with clients that are reporting deficits with walking. And they're having that difficulty staying upright and walking for long periods of time. And so if you notice that as you're walking, the further and further that you walk, not necessarily building up leg symptoms and that your leg pain is worsening, or if you have leg pain at all, it's more in the lower back and that you find yourself leaning forward a little bit, and that becomes difficult over time. And I want to go over two great mobility stretches that could be a great 1-2 punch for you to start working on top of your other strengthening work to help improve the way that your hip and your back interact while you're walking, because we are built to walk and we should be able to do it for as long as we would like. Okay, so let's go over two things that you could be doing to help improve your ability to walk. So when we walk, we are upright, and that upright upper back requires, a little bit of joint motion and tolerance, but it also requires hip movement as well. So if you think if my hips were here, right, I'd be upright and that leg would be swinging back every time I go to take a step and forward. Well, in the people that I treat that have difficulties walking, a lot of times going forward isn't the issue, but it's that hip extension. Because when we walk, walking is an extension-based task, so we're upright and we're nice and tall. Well, if we lack hip extension, we're going to ask our back to do more extending. And that's okay for a short period of time, but if you go for a walk that's 3,000 steps, you're going to start feeling it. And so that hip extension, improving the hip extension, can help reduce the strain and the extension intolerance of your back to help improve the tolerance of walking and extension-based exercises. So I want to go over not only improving lower back extension and its tolerance, but we're going to also improve our hip extension as well. So let's go over the first exercise for that. Right now, all you need to do is get on the floor or even your bed or a surface that is fairly firm. And we're going to go over one of the ways that I have found to be beneficial for these people, improving that walking tolerance without aggravating, but actually doing it in a way that you can notice change over time. Here we go. Okay, so the first exercise here, we're going to get into what's called a quadruped position. So hands underneath shoulders, knees underneath hips. And this is just a great mobility exercise anyways, but what we're going to do is just be in a comfortable position. And you're going to notice that I'm not sticking my butt out. I'm not tucking underneath. I'm kind of in the middle here. And then we're going to move our hands forward just a few inches. And we're going to go down into the prayer stretch, but then immediately come up and sink our hips to the ground. Prayer stretch, hips to the ground. So the key here is really doing this slowly. And you want to move into some of that mobility and just try to think about gaining some further range into that extension every time. This is flexion. This is extension. The reps I typically do here are about 30 reps. And you can see that I'm taking my time here. And what I'm feeling here is pressure in my lower back, but I also may feel some stiffness in the front of my hips. And I'm regaining some of that motion because conditions such as arthritis, degeneration, disc bulges, facet changes over time, all things that I'm sure people have seen on MRIs or x-rays, respond very well to this mobility work. Regaining that flexion and extension. And we're not hanging out there for very long because remember, extension, this one can be a little stiff, or what I say, sticky with my clients. We want to stay away from those sticky positions and move into those positions that we can really feel that improvement, but then come out of it. So we're loosening up our spine and we're getting ready for it to work. Walking is a very, very much needed functional ability, and we want to be able to do that. And we want to be able to improve our walking tolerance. And so that first comes with improving some mobility. And then we're going to go into my go-to strengthening / mobility exercise to help improve walking, but with some nuances that's going to allow you to feel the difference without feeling the repercussions of walking too long. All right, I know you guys are going to give me some grief here, but the last exercise, the second one, only the second one, after we improve that flexion and extension ability, of our lower back with the prayer into the prone extension, we're going to move into improving our hip extension, our hip flexion range of motion, because we have to have good hip flexor mobility to move into that extension position with gait, because this is walking, right? As I'm walking, that leg is behind me. I got one leg in front of me and my back is nice and upright. And when people have problems walking for long periods of time, it's usually because they lack hip extension strength, but then they also lack hip flexion range of motion. And so I wanted to put together an exercise that works on both of those things. And people usually give me grief on this because they have hip replacements, knee replacements, back surgeries, whatever, and it feels like they're limited from doing lunges again, but that's absolutely not the case. To work into lunges is very, very normal, but it's how you do it that makes a difference. And so what you're going to do is start in more of a lunge position, a stagger stance next to something sturdy. And that back leg behind you already, if my right leg is behind me, I'm gonna rotate my hips to the left so I'm nice and square forward. My hips are facing forward, not out. And with that leg behind me, I may feel a stretch already, but then I'm gonna start leaning forward. Here's the areas that people typically feel it. 1, calf, ankle. 2, front of the hip. And 3, maybe in their lower back a little bit, similar to what they feel while walking. Well, this lunge exercise here, if you start off by holding on, which is fine for balance, but then progress into dipping down and doing a little bit of bend as far as you feel comfortable, can give you that length and strength that you're looking for. Let's go from the other side here. So this time the other leg's behind me. I'm going to stay nice and tall and upright, and I'm going to lunge forward here. You can see hip flexor mobility, hip extension strength through my glute, ankle mobility, and working a tiny bit of balance as well. So it's a good win, so many win exercise that can dive into those ranges that we're looking for. So what I recommend is people do upwards of 15 or 20. I know that sounds a lot, but you think about how many steps you take while you walk. And so we've improved back mobility, and then we've worked right into the hip mobility, which is great. So let's get 15 or 20 reps on each side. And if you guys stick with this, even if that range of motion is super small to start, you're even smaller. If you're staying upright and just diving into that mini lunge, that's okay too. There's lots of ways to get the job done. You just got to show up and start doing it. So work into your lumbar mobility to improve that extension, and then work into the muscles that help you support that extension while you walk. I know I'm making it seem a little more simple than it may actually be, but I've seen so many people improve their intensity of their discomfort and how far they can walk just by doing these few things. It's great. It's absolutely great. I know you guys will like it. Enjoy those lunges. Enjoy improving the mobility of your back. And let me know how you feel. Leave some comments in the description. Tell me how that was for you. The reps and sets will be in the description as well. And as always, guys, just stay healthy, keep moving, and take care of yourself.